Welcome to Spine Academy. In this video, we're going to discuss the role of physical therapy in the management of cervical spondylosis. This is an excerpt from a broader course on the non-surgical management of cervical spondylosis. If you're interested in seeing the full course, we've left a link in the description. One of the most important and effective non-surgical modalities that we use for treatment of cervical spondylosis is physical therapy and sometimes occupational therapy for myelopathy. Physical therapy is such a broad category, and by no means am I an expert on all of physical therapy, but I'll do what I can to kind of give you a high-level sense of what we're trying to achieve with it and the different modalities that they might use. So the goals of physical therapy on a high level are really a few things. One, we use it to try to help reduce pain. We also try to use it to improve mobility, which as people get older, everyone can use. We try to improve endurance and increase strength. And those are like high-level goals. Now, specific goals will be tailored to you as a patient or to your patient if you're a provider. And typically when you send somebody for a physical therapy evaluation, it will start with defining that person's specific needs and the goals of treatment. That will dictate the specific types of modalities that are employed. Now, this cartoon here is very cute at highlighting the fact that there are so many different modalities that can be employed that all of which maybe no single person is going to really need, but your physical therapist will help figure out which of these really make the most sense. Now, if you think about the different modalities that are available, and there are many and even more than what I've listed here, I'll just highlight some of the common ones. So exercise is the one you think about all the time. That's what if you told me physical therapy, that's the first thing you think about. And that can be both active and passive exercises. Another modality that I find patients find real value from is ultrasound. And ultrasound is a way of stimulating using different sound waves, the muscles, and evidently I have patients that certainly get relief from that. That's something they may employ. Massage therapy, of course, who wouldn't want that? That's a very effective way of kind of relaxing some of the muscles and treating some of the symptoms that people get with spondylosis. Electrical stimulation and TENS unit can be effective, and that is something that they will put leads or pads on you and stimulate the muscles or nerve endings, and that can sometimes give a fair amount of relief. That's one modality that people will sometimes use. Traction, so this is effectively stretching. I find many patients actually get relief from traction as well, and physical therapy places will do it, chiropractors may do it, and of course you can buy devices that allow you to do traction at home. But the idea around it is by stretching that you can unload the discs, unload the joints, and maybe unload the nerves. So traction is a modality that some people will employ during physical therapy. Passive mobilization, which can help with range of motion, it's specifically in joints, and certainly that's just as relevant in the neck. Heat and ice, and of course heat is directed at trying to improve perfusion or blood flow to an area. Ice is designed to kind of reduce inflammation, and both of those may or may not be employed by your therapist. And then hydrotherapy, or therapy that involves water. And all of these are a subset of the different modalities that physical therapists will use, but all of them may have some degree of value when treating your cervical spondylitic symptoms. Therapy happens in different settings, and I think this is an important thing to kind of highlight, because a lot of times patients will come in and think, well, why can't somebody just come to my home? So therapy happens in a few different types of settings. The inpatient setting, which is a setting that you might find in a hospital or in an acute rehab facility. It is uncommon for somebody with an episode of spondylosis to find themselves in a hospital or an inpatient setting, but I put it in there because there's really high-level physical therapy that can happen on a daily basis in a setting like that. In an acute rehab facility, for example, people can get 3 hours of physical therapy every single day. And of course, you make huge strides with that and improvement with that, but that tends to be used primarily, in my context, after surgery or after some type of spinal cord injury. The second category to talk about is the outpatient setting. So this is a facility that you would drive to. There's different types of outpatient settings. You can get aquatherapy or water-based physical therapy. And of course, what we call the alternative to that is land-based physical therapy, which is where you go to a facility that has a lot of equipment that enables them to use those different modalities that I highlighted just a few minutes ago. This is a picture here of when I say physical therapy in an outpatient setting, you think of a setting like this where there are a lot of resources that they can use to tailor your treatment plan to your specific needs. Outpatient physical therapy, again, you have to drive there, so there's a bit of inconvenience with that or be driven there. And it typically is done a few times a week, as opposed to daily and inpatient or less frequently in home. But outpatient is probably the lion's share of the therapy that I send patients for. And then the last setting that it can happen in is home. So of course, home is a situation where somebody comes, a therapist comes to your house, they might bring some equipment with them, maybe some dumbbells, as you can see in this image over here, maybe some belts or some other equipment they can do with your stairs, but it's much more limited in terms of the types of things that they can do. It may not be as frequent or as intense, but certainly better than nothing. So thinking about the different settings can help you figure out what would be the best for you in terms of recovering as quickly and effectively as possible, and everyone's needs are a little bit different there. Now, when you're looking for a physical therapy center, and again, it's hard. I would ask friends and colleagues and get good referrals. I get patients look for recommendations all the time. But I would kind of highlight these attributes. When you're looking at a physical therapy center, the question is, what makes a physical therapy center good? I think there are a few important criteria. Number one, I think that it's important you go to a place that will really do a thorough assessment of your specific issues and your specific needs, and then establish goals that are unique to you. That's number one. You want to go to a place that's going to tailor a plan around you. The second thing to mention is that you want them to really individualize that treatment plan. So as we talked about all these different modalities, the different types of treatment, nothing about physical therapy should be one size fits all. You shouldn't go to a place where they give you a sheet of paper that has the same exercises they use for everybody with neck issues. You want them to individualize it to some extent based on what your needs are and the goals are. You want to go to a facility where they pay attention to you. And I'm not saying that they're 100% of the time with you, but they should be mostly with you. If you're doing a 1-hour session, it shouldn't be one of these situations where you see them, they put you on an exercise bike for 20 minutes, come back and say, okay, let's put you on this other machine for 20 minutes. You want them to be with you and directing care to make that hour worthwhile. And then you ideally would want to have consistent physical therapists, either one or a few, but people that clearly communicate so they're part of a team that is helping consistently work towards a unified, cohesive goal. Those, in my mind, are what make up a good physical therapy center. So if you go to a place and they do all these things, chances are it is a good physical therapy center. That is what to look at. Now, in summary, I would say physical therapy is incredibly effective, it's incredibly commonly used, and it's incredibly valuable for patients with cervical spondylosis. Coming up with a good treatment plan is a function of going to a place that will help you develop that based on your specific needs, based on your specific issues, and the goals of your treatment. Thank you for watching this video. I hope you found it informative. If you've enjoyed it, please like and subscribe. If you have any questions, comments, or ideas for future content, we'd welcome them in the comment section below.